Hi, Tennessee Voices viewers. This is David Plazas again, the Opinion and Engagement Director for the USA Today Network Tennessee and the Tennessean. And delighted to have Senator Brenda Gilmore, who serves in the Tennessee General Assembly. She represents several parts of Nashville there, but also has a statewide view on a variety of issues and has been a leader in the state and the community for a long time. She was previously a state representative and has been very vocal, especially during this time, about issues of racial equity when it comes to COVID-19. And we'll be talking about that and other things in today's conversation. How are you doing today, Senator?
I am super. How about you, David?
I'm doing excellent. I'm feeling good and healthy and hope to remain that way. And you wrote a op-ed that ran recently, a very powerful one where you took to task the history that related to racial equity when it comes to public health. Would you talk a little bit to our viewers about why you wrote that and the importance of the subject?
Yes, I'm very concerned. I think that this COVID-19 is just going to ravish Black communities. There's always been health disparities, but this pandemic has really shined the light on the disparities. It's almost a trifecta effect. You got poverty, not having access to good health care, good affordable health care, and the fact that so many people of color, particularly African Americans and Latinos, are on the front line. They're in what's considered as essential jobs. They're driving cabs and Ubers, transportation, working in the food supply area, and healthcare. And so it puts them in a vulnerable position. And so when they come up with these underlying positions, which are caused by some of our, I hate to say it, but it's just it, our racist policies over the years, it's made people who look like me very vulnerable to this disease. So not only are we being infected at a higher rate, we're dying at a higher rate. Yesterday, I listened to the mayor's briefings, and it looked like about 30% of African Americans in Davidson County have been affected. But of the 19 people who had died, 10 were white and 9 were African American. So almost 50% of the people who are dying as a result of this disease are African Americans.
You'd mentioned the racist policies over there. Obviously, there's Jim Crow, the legacy of Jim Crow and segregation, and there's still lack of access to health care, and there's the issue of schooling and food deserts as well. And I can imagine that there's a lot of pressure on families with school being out right now. What have you heard?
And the fact that because of also inequality in housing, affordable housing, then you also have a number of African American in clusters and housing projects where we can't shelter in place and maintain social distances. There are multitudes of generations in one house, several sleeping in the same bed, which is all a result of poverty. And so that's difficult. In low-paying jobs that you have to go out and work every single day, and you can't do your work at home. And I admire these frontline workers. I really appreciate them. They are really our unsung heroes. But unfortunately, they're dying at a higher rate as a result of these factors.
One of the things I enjoyed about your column is that not only did you identify the problems, but you also offered some solutions. Among them is the expansion of Medicaid. Would you talk about that and other things that you're thinking about to try to address the problems that we have?
Well, to me, it's a moral issue. It's an economic issue that we're leaving billions of dollars on the table that we could be using. It makes no sense, really, when you think about we accept federal funds to fix bridges and highways and streets and potholes, but we can't accept federal dollars for health care. There's no logic to it at all. And we have something like 400,000 people in Tennessee who are uninsured. And they were already dying. Everyone was dying. Both white and Black Tennesseans are dying as a result of not being able to get preventive care. And when they do get sick, because they don't have insurance, then they're waiting longer to go to the hospital. And so it's more difficult to keep them alive. But if we had, if we would expand Medicaid, then those people, they wouldn't stay home the moment they felt sick or felt like that they were not, that they may have the COVID disease, they would go and seek help. But right now, their only source is emergency room. That's their primary care, emergency rooms.
Now, during the whole debate over Insure Tennessee and Medicaid expansion, you went from the House, the Tennessee House, to the Tennessee Senate. Is the debate any different from one chamber to the other?
I don't think so. I think some of my colleagues, whom many of them I respect greatly, across the aisle have just dug their heels in, and they're just not going to budge with this expansion of Medicaid. But again, there's no logic in it. Even when you look at the money that we're accepting from federal government for COVID, which is millions of dollars, in fact, it's billions of dollars, it's still federal funds. So to say you're not going to accept federal funds for the expansion of Medicaid when we accept federal funds for the rest of our budget, which over a third of our budget is federal funds, there's no rationale, absolutely. We should have compassion for these people who are dying needlessly, just simply because they don't have access to good health care. And had they been able to go and get preventive care all along, been living in good housing, had better paying jobs, but as policymakers and even looking in the prison system, there's an equal amount of Black people, particularly men and women now, that in our prison system compared to the percentage that we comprise of the population. And they again are in crowded situation. And we're beginning to see that this virus is getting out of hand in the prison system, even though I do have to commend Commissioner Parker. He's doing some outstanding things. But up in Bledsoe, they tested 425 people, and I believe 150 of them tested positive. So I hope that that's not true of all of our facilities, but I thought that those figures were appalling.
Well, that's really interesting that you mentioned that, because it goes to the whole criminal justice debate, and there have been some, de facto reforms that have happened, in terms of, at least in Davidson County, I'm aware of the suspension of drug testing and also the release of certain nonviolent offenders. Do you hope that these become more permanent when the legislature reconvenes this summer?
I think that we should. I think we should have the prison system for those hardcore prisoners who've done heinous crimes, and there's no salvation in them reforming. For people who have had minor, non-violent crimes, most of them are in there for drugs, then I think we should come up with alternative sentencing for these individuals, and at least give them a second chance. We're in the Bible Belt, but our policies just don't reflect that.
Well, I want to change the subject for a moment to ask you how you're coping personally during this time of self-quarantine. What are you doing to stay sane and occupied and healthy?
Well, I'm working just as hard if we were in session. Yesterday, I think I had 5 Zoom meetings, but I do try to get out and walk every day. I walk on the trail at Hartman Park. I've been going over to Hunters Lane and Whites Creek and Cedar Hill, walking, just trying to get some exercise so I can work off some of these quarantine pounds that I've gained since I've been sheltering in place. But that's basically it, doing a little reading. I told my daughter, though, I'm very pleased that there is something positive about this pandemic. I think it's forced all of us as family to be closer and have more time to spend and talk with each other.
Well, you'd mentioned before we started recording, and we're recording today on April 23rd for viewers, that you also are still doing some volunteer work. How were you able to do that during this time?
Well, one of the churches that's in my community contacted me and told me that they were working, it's Olivet Baptist Church, working in partnership with Second Harvest. They feed over 400 families, and that they needed some masks. Their volunteers didn't have masks or gloves. So I put a call out, and then I went over one day just to observe it. And since that time, my husband and I have been going over every Wednesday and volunteering and feeding these families. And I'll tell you, David, there's a lot of need in Nashville. A lot of people, a lot of children are going to bed hungry every night because their parents simply cannot work. And the students who were in school, sometimes that was their only nutritious meal that they were getting when they were in school. Of course, the school system is doing a good job of delivering them to meals, but they can't feed all the students all over the whole county. So on Wednesdays, they feed at Olivet Baptist Church from 3 p.m. to 6 p.m. I give out food baskets. And on Thursdays, it's 10 a.m. to 1 p.m. So I go over every Wednesday from 3 to 6 and volunteer giving out food baskets for people who need food.
No, thank you for doing that. It's really important work. And, you know, some of the things that have been heartbreaking is stories both in Tennessee and beyond of farmers who are having to throw away a lot of product, be it milk or vegetables or other harvests because there's not the demand that there was before because restaurants are closed. Now, you may have heard that this morning, April 23rd, Mayor Cooper announced 4 phases of reopening the economy. And it all depends on either a decrease in cases or flattening of cases. What's the sense of what is the business community saying to you in terms of what the pressures are on them?
Well, I know the business community is anxious to get back. After all, businesses are the backbone of this country, and it keeps it fueled. And employees, of course, would be able to get a salary. At the same time, I do appreciate Mayor Cooper being cautious about it because a sick community certainly can't work. And if we rush to go back and have a resurgence of this virus, then I think we'll probably be in a worse shape than we were than where we are now. Because everybody, all the experts, health experts say it will hit much harder. So I was just cautious. Both the governor and the mayor to just try to make a good decision and don't rush to judgment too fast. Because if the numbers don't show that we should open up, then we shouldn't do that. And even when you look at the places that are going to be opening, the barbershops, the saloons, the nail shops, that again is going to be people of color, and it's going to put us in close proximity to each other. And because of some of the underlying conditions like cancer and heart disease and diabetes and asthma, then these are the people who will catch the virus and it will hit the hardest and result in fatality. So I am very concerned about it. I would just say that, very concerned.
So the legislature is set to reconvene at this time on June 1st. What do you hope that the legislature accomplishes, and what do you hope that they don't do? Because sometimes there's a lot of issues of trying to prevent certain legislation.
Well, what I hope we don't do is I hope we don't do what we did when we adjourned, and that was we did not maintain social distancing. We were all clustered on top of each other in our individual chambers. I was hoping we would be able to pass some of our important legislation. I have a piece for small businesses, and I was so hoping I would get it past this session. What I saw, what I'm hearing is, though, that we will continue to just look at those bills that have to do with that will have an economic impact. We passed an emergency budget right before we left. As you know, it's by law that we have to pass a budget, and we did that. And I thought we would be able to go back and continue, but it doesn't look like that. It looks like we're going to go back and just take care of those essential things that have a direct impact on the budget. And it also looks like that there may be some more severe cuts. But I am very proud. I think that the governor and the past General Assemblies have done a good job of putting money away in our reserve. We have a very healthy reserve, over $1 billion.
One of the concerns I hear from readers is about the unemployment system and getting those unemployment payments. Are you hearing the same thing? Because I'm hearing that people are either not able to access benefits or not knowing. There's a lot of confusion, it seems.
Yes, and I think some of it has to do with the fact that so many people are applying for unemployment, but that doesn't help at all when you haven't had a paycheck in a month and you're trying to get through and all you get is fast, busy tone or no returning phone calls. So there's been a lot of problems with our unemployment system. Just this morning, I got up and sent an email to the department to try to help a constituent. This is a constituent that was a beauty stylist. And I think that they probably incurred more issues than anybody, those individuals who were self-employed in trying, and with the COVID relief funds, self-employed people can get some help, about $600 a week. And so just trying to help them to maneuver through the system. It's a very complicated system. It's overburdened, and it's probably, the system is probably just not up to par to handle the volume and the complications of this environment is requiring.
Well, Senator, I want to thank you so much for your time. We've got a couple minutes left of the broadcast, but I was wondering if you could leave us with some words of hope or advice or wisdom for our viewers as we continue to go through this very challenging time.
Absolutely. My grandma, I grew up in Gallatin. I don't know if you know that. I'm a small town girl. I grew up in Gallatin. My grandmother raised me, and she had a saying that says, this too will pass. And I believe that. I believe that we have many brighter days ahead of us. We just have to hold on, try to be as positive as we can, try to be as encouraging as we can, and look out for one another. Our neighbors, as I shared with you earlier, some of our neighbors are not faring as well as some of us are. Some of them are hurting. So check on them, call them, send them a note. We want to make sure we take care of our post office too, because our post office is important. And just believe that better days are ahead of us. Remember to wash your hands often. Do it at least 20 minutes. If you go outside in groups of more than 10, make sure you wear a cloth covering and maintain social distances. Try to get some exercise every day.
That's great advice, and your example of being a volunteer is wonderful. It reminds me that my colleague, Ms. Cheap, has a penny drive with Second Harvest Food Bank, and they could really use the support, either financial or volunteer work, to help feed hungry families. For our viewers of Tennessee Voices, you can watch this broadcast on Tennessean.com/opinion, as well as past episodes. Senator Brenda Gilmore, I want to thank you so much, and I hope that you stay healthy and well.
Thank you. Thanks for this opportunity. Same to you. Have a blessed day.
To you as well.